the presentation, or the piece of history that's written in the document is my take on a historical overview. But I thought I'd make it a little bit different, the presentation a little bit different, and I believe this may also be up on the website. Excuse me, because actually I think my overview is not perhaps as strong in its conclusions as I would have liked it to be. So what I wanted to start by saying to you is that none of what I'm going to say is new. It will be new to you perhaps, except the way it might be constructed. But policy direction doesn't happen in a linear fashion, and it often is at the whim of events, dear boys events. And the early childcare supplement to the free preschool year is a case in point. And so I wouldn't perhaps be as hopeful as Toby, and you'll see why, that it marks any particularly significant change in policy. But the intention of the presentation really is to hark back to Helen's recommendations, linked back to her observations about quality and the need for quality in early years services, and to try and give some overview as to how we have found ourselves in this position in Ireland, and how we might get ourselves out from under being the lowest marker on all scales. And I was reminded of the fact that back in 1996, when the European Childcare Network reported, Ireland, the UK and the Netherlands were at the lowest, and there's been significant changes and developments in the Netherlands and in the UK. So I'm going to. This is selective. There's more detail in the report. There are a number of key drivers that have led to where we are now, and they relate to demographic, social and economic changes in Ireland over the last couple of decades. But the biggest increase in investment happened as a response to increased demand for childcare services to facilitate female labour force participation. And the push to drive that highlighted the inadequacies in provision of quality and affordable early years services in Ireland. And so in 1999, a national strategy for childcare was published. Now, there were two problems with this strategy, and I wish I could say that we didn't realise them at the time, but we did realise them at the time, and we highlighted them at the time, and it was not possible to change the direction. But one of the critical features of that report was the restrictive nature of its terms of reference, which limited the group to considering the childcare needs of working parents and their children. So it was a very specifically labour market driven initiative. And furthermore, the extensive brief to cover the age range from 0 to 12 has led to consistent confusion terminologically across the sector. And so we had in 2008, in the first publication of the State of the Nation's Children in Ireland, the indicator for early childhood care and education was the number of children under 13 in services. And I thought that the 13 was a mistake, but it refers to this brief that the National Childcare Strategy had. The outcome of the strategy, out of which a lot has developed, was the establishment of the EOCP programme and the NCIP programme, and these programmes laying the foundation for continued, although now less extensive investment in the sector. And one of the consequences of the need to increase these childcare places as rapidly as possible was the focus on centre-based institutional childcare over the kind of mixed service development that we had. And we still have, for younger children, that idea of sharing the sort of care of children across varieties of settings. But it certainly fueled the growth of a centre-based services. Under the NCIP, private providers were incentivised to apply for funding because there was a very slow growth at community level in meeting the targets that were required. And so we have some 70 to 30, I think Toby said it was 75 to 25, but that's the balance of our provision. So whether we like it or not, this is where we are in terms of the sorts of services that are available across the age range from 0 to 6. Until recently, the preferred policy instrument for supporting families to both access and pay for childcare services was through direct cash payments to parents. And there was another key policy development happening at the same time. And this is one of the difficulties with the Irish situation. So almost to the day, in 1999, for those of us old enough to remember, the Department of Education and Science produced the White Paper on Early Childhood Education, Ready to Learn, dealing with the same range of children, talking about the same services and coming from a different department. And it focused on the early educational needs of children from birth to 6. And just for those who mightn't be familiar with it, the compulsory school age in Ireland is 6. And it included recommendations which covered the whole spectrum of early childhood services, but prioritised the age range from 3 to 6. It did reference not only the range of services, but actually in one of its really important references, it highlighted the role of parents in the role of early childhood care and education within the mix. But nonetheless, it did clarify that its main focus of attention was the 3 to 6 age range as a first start, but nonetheless. So arising out of that, and that's a mistake on my part. It should be reading out, from the education, the Ready to Start document. The SHIELTA National Quality Framework emerged in 2006, and the ASHTR Curriculum Framework emerged in 2009. So you can see that of these kind of two 1999 pillars of strategies, we've actually found ourselves in a position where there's a larger sector than there was, which was well invested in terms of places, and we have these two significant practice documents in terms of quality and curriculum. However, the policy actions arising from the White Paper were not aligned to those arising from the National Childcare Strategy, and the absence of this coherent implementation plan for the sector meant that until as recently as this year, they were considered in isolation. They were not considered together. And indeed, in some instances, you find people familiar with ASHTR who haven't heard of SHIELTA. And as maybe 4 years ago, I was finding in certain areas that SHIELTA and ASHTR were being confused with each other, and that there were all sorts of misunderstandings about what was the responsibility or the remit of the documents. But broadly speaking, SHIELTA was seen as a framework for enhancing the quality of care, while ASHTR was seen as an educational framework. Some further difficulties which exist that with these documents, that although they were developed at different times and by two different bodies, they both fall under the remit of the Early Years Education Policy Unit in the Department of Education and Skills, which is co-located with the Department of Children and Youth Affairs, with the Childcare Directorate, and recently with TUSLA, the Child and Family Agency. However, the experience on the ground is such, and I think there's ample evidence of this, that co-location doesn't necessarily yield coordination. And until recently, we also had the Department of Health in the mix. Now, I'm not sure where they stand now, but anyway, but nonetheless, the principle behind co-location was broadly welcomed. Its potential was immense, and it simply doesn't seem, for some reason, to have led to the coordination. I have at last. Thank you very much. Yeah, thank you. So the consequences of this have been the absence of a strong link between the development of childcare places, support for training and enhanced quality initiatives across the early years setting, and this has contributed at least to poor practices revealed in some settings and exemplified by the breach of trust documentary aired in 2013. And this is the core of the problem. Irish policy responses to the demands for early childhood have been reactive and broken from the beginning. And I'm reminded of Beckett with his fail and fail and fail better. We can't expect to have a system that is coherent, integrated and of high quality if we start with broken bits from the beginning. And that is a serious dilemma that we face now that we are where we are. And it shouldn't come as a surprise to any of us that we have a dysfunctional, poorly supported, fragmented and costly early childhood education system which mitigate against the development of quality services. And it is costly in a way that is relatively invisible, because it sure as hell isn't costly in terms of bucks. 260 million euros a year is very little to pay for services that are to meet the needs that are out there. Where it's costly is in terms of its impact on our children and the stresses that it lays on a sector of which huge demands are made with very limited investment to support those demands. So it is a costly service. The absence of an integrated vision is one of the key difficulties that we face in this area in Ireland. Irish macroeconomic policy continues structurally and conceptually to maintain a clear distinction between childcare and early education. And this fact is supported by the continued separation of childcare and early education policy units within the DCYA. Despite ample research, and Helen's paper builds it together very, very well and succinctly, on the importance of a coherent and integrated overall system if we are to develop and maintain quality in early years. That absence of an integrated vision is alive and well where it matters most, which is at government level. And then we have the case of investment. Until recently, as I say, the preferred policy was supporting parents with direct cash payments. This avoided a number of things. Most particularly, it avoided the direct provision of early childhood services, because that policy could be perceived as a restriction of parental choice in relation to early years options. I spoke at a political meeting some years ago, and I was met by the Taoiseach. And the Taoiseach ushered me in to the ante-room before I went into the big room, and asked me to make sure that whatever I said on the podium didn't set the women in the home against him. And that wasn't all that many years ago. But it reflects this notion of giving this parental choice. It's this idea that it's the state interfering with family affairs which are private that has bedeviled the sector in terms of getting a coherent, in my view, in terms of getting a coherent vision. And then we had the investment in the universal free preschool year, which is a direct investment in services and not parents. However, I would just remind you of how accidental almost that decision was. It certainly was not a coherent reflection of a coherent integrated vision for services for young children. And there is no similar mechanism in support of services for children under 3. And it was, Toby has mentioned this, and it's out there in the ether. But the system actually, again, mitigates against quality services for children under 3 because it doesn't incentivise qualifications, it incentivizes qualifications for the free preschool year. Now it is changing, but again, it's a reactive, incremental blip that we seem to proceed in what I've called before progressive incrementalism. And I go back to the beginning that if we progressively and incrementally, slowly try to build a system from what was originally broken parts, we are going to continue to get a broken system. And then we have the case for investment too. The free preschool year is underfunded, and yet there are huge demands made on poorly paid staff. It may not be a direct demand on you personally, but all the rhetoric around the free preschool year is around how wonderful it is for young children to receive quality early childhood education. And then its inspections come through and problems occur and parents have difficulties and staff are seen to be the problem. So we've really got things badly wrong in relation to building quality support services, because not only are we not investing sufficient funding in quality supports, we are actually alienating the sector that could provide those quality supports. And I think it can be seen as a cynical attempt to appear committed to quality early childhood education when really there is no evidence that there is that deep commitment. Everybody has been pointing out about this 4% or 0.4%, would that it were 4%, and that when you actually pull out the investment in infant classes of the primary school and in the early start, the actual public investment is down to below 0.2%. That is really, really not good enough anymore. It doesn't matter, as Kieran said earlier, how poor we are. That is an absolute disgrace. So can this broken system be fixed? Well, I think the first thing we have to recognise is that it's not going to be fixed easily. And no amount of rhetoric is going to change that. If we're to get serious about early childhood education, we need to get serious about investment. There needs to be a shift, however, to an agreed integrated government vision and action for early childhood education and care across all settings and across all ages, which goes beyond the rhetoric and the hand-wringing. The rhetoric being, it's all great and wonderful and this is what it can deliver, and the hand-wringing being, we can't afford to do it. We've got to move beyond that, and it's not going to be enough to give another 50 million here or another 100 million there. Actually, we have to go back to the drawing board, at least in part, and utilise what we have, because we do have lots of settings, and we do have, well, we don't have enough settings, but anyway, we have more settings, and we have the two really good pillars of practice, which are, let me tell you, poorly understood. They are very poorly understood. So, children should be able to expect quality early years experiences. Quality depends, in part at least, and majority I believe, on staff. And staff need training. They need initial and continuing professional development. And I'm going to use a word here that for other reasons I very, very, very rarely use in relation to early childhood education. And I'm going to use the term appropriate. There are all sorts of reasons why appropriate is problematic. For those of us in the area, we know why. But actually, training needs to be appropriate. Excuse me. And we know that regulation and inspection can support quality practices where it integrates care and education. There is no doubt from Helen's work and research that regulation is really critical if we are to ensure quality. And I was delighted to hear the Minister say this morning that he wasn't going to be putting too much more red tape on the sector with this additional inspection system. And this is where the sector is being killed, actually, because the new systems of reporting, the checklists that have to be ticked, the quality that, you know, the sort of skills you need for it. I remember back in the 1980s, writing about early childhood services in Ireland. I was specifically looking at the Eastern Health Board, as it was then, nursery provision. And I remember making an observation that the quality of services depended on the quality of financial advice a service got. Because actually at the time, you needed to know where to get the money. And you know, it's still the same. What kind of support services can you get locally to do some of the work that you're expected to do day to day, as opposed to doing what you were trained to do and what you want to do and why you entered the sector? So regulation is important and inspection is important, but it has to be a support and it has to be positive and constructive and not just a kind of bureaucratic red tape developing kind of mechanism. And inspection teams must include professionals with qualifications in early childhood care and education. I don't know why that's such a hard thing to get. I mean, primary teachers would not be inspected by people, and nurses don't expect anybody else to be watching over them. I mean, it's just, I really don't understand why that point isn't kind of grasped. And that's what I mean about the system being broken, and the broken bits adding to the difficulty of fixing the broken system. Because when the inspection services came in, another pragmatic decision at policy level, because I remember what the options were. I don't know that it's written anywhere, but when I write my memoirs, anyway, there was either we do this or we do that, and it's cheaper to do this decision. And what happened was that if it was going to be delivered within 6 weeks after it was announced that it was going to happen, you had to use what was there. And environmental health inspectors and public health nurses were available, and into the teams they got. At the time, I would have to say, there was no degree level in early childhood care and education. It had to be done. But the inspectorate, there was no mandate on the inspectorate to receive any training in the area of early childhood care and education. Local structures can be an asset in supporting and informing policy, but there needs, in my view, to be a clear leader at a national level to guide a strong network of local level systems. And I'm not sure that we know who that leader is still. Policy and practice can be enhanced through supportive monitoring and evaluation, well-designed research. But again, we have to know what it is we're monitoring and evaluating and researching. So, and as I keep pointing out, we have the wherewithal to provide an excellent early years experiences for children in Ireland. For all our young children, we just need to think about how we can utilise them to the maximum effect. I've kind of stopped being apologetic to myself, you know, when I'm making, because I try to support everything I say with the evidence that's there. I try to be able to stand over what I say, because there's no doubt about it, it's an area that I'm passionate about. But I think we've gone beyond having to provide proof and evidence of what's important. And actually we're at a moral, there's a moral responsibility now on us to get things right. And we must have serious reform, which places the child at the centre of policy and of practice. And we've got to work within this mixed model of provision that's developed. And we have to find ways to realise the rights of all children to have quality early years experiences wherever and whenever they happen. And if that's in the home, through us providing supports for parents so that they can use early years services occasionally, well then that's what we have to provide. If we have to provide daycare that is offering full-time services, we really want to be sure that that is of high quality. So I think we have a moral crusade on our hands, and I think we have a lot of reforming needed. So while I agree that we need a reformed model of investment, if it's building on what we've got without changing where we started, it's not going to have the desired effect. So I think we've got a big challenge ahead. Thank you.